Right now, the state of Michigan is reporting more COVID cases than it has all year, but health officials say the pandemic is over.
In May of this year, the U.S. Department of Health and Human Services put an end to the COVID-19 public emergency. Now, this chart shows a clear uptick in both probable and confirmed cases, peaking at 602 probable cases on November 27th. This data then begs the question, how do we talk about COVID-19 when it's prevalent but no longer a pandemic? Fox 17's Sam Lanstra has the story.
Yeah, that's really the million-dollar question. But first, let's take a look at another data set, one that the CDC actually collects. Now, this is a measurement of COVID-19 in Michigan's wastewater. And it's sort of a canary in the coal mine. That's because people actually shed the virus in their stool, often before showing symptoms. And as you can see, Michigan is well above the national and regional average. Michigan is that yellow line that's ticking up near the end there. And that means cases are expected to start climbing, and they already are. But this year is different. The pandemic is officially over. And this is what the state health department's top doctor had to say about it all.
COVID is on the rise. This is something we expected to see.
The state saw what was in the pipes and saw COVID coming down the pike.
So that's one of the metrics that we look at, but it's only one, and it really has to be taken in the larger context. Now, the thing with wastewater is it can be an early indicator, and it can actually be a sign that we start seeing increase before cases start going up.
But despite the rise in cases, the two factors that should control this post-pandemic winter are vaccines and immunity.
COVID, since it was an emerging pathogen and a pandemic, it has really morphed into something that is what we call endemic. And we expected to see this become more of a seasonal problem rather than something that was coming in what felt like very random waves.
Now endemic to Michigan and America, COVID in some ways can be considered alongside other seasonal ills.
We're in a different place in terms of how deadly COVID-19 is. And so we're really starting to talk about winter virus season as being the time where the big three circulate, and that's COVID-19, influenza, and RSV.
And with all of these viruses come vaccines. Dr. Bagdasarian says they're still and always have been worth it.
Immunity wanes over time. So your best levels of immunity are for the 3 months, 4 months, 5 months after you've had a new shot. While getting vaccinated is an amazing tool, we have to keep in mind what it is a tool for. So it is a tool to protect against the serious complications.
With the pandemic over, even as cases still spread, Bagdasarian says how we talk about COVID should change too.
I think that COVID was so politicized during the pandemic. It really became a political touchstone. I think we have to understand that COVID is a health issue. It is nothing more than a health issue. It is not a political issue. And getting vaccinated is something that we encourage people to do for their health.
Now, if you're looking to get vaccinated, really, you can just Google where to go. They're available pretty much everywhere. And the federal government is also offering 4 more free COVID tests, and you can get them at covid.gov. For now in studio, Sam Lanstra, Fox 17 News.
The CDC says across the nation, only 16% of adults have updated vaccinations. And the number of RSV, flu, and COVID cases are becoming more concerning as we enter the holiday season when many start to get together. Just last week, Cornwall Health announced visitor restrictions amid growing inpatient rates for respiratory illnesses at Helen DeVos Children's Hospital. In the last week alone, about 800 people were hospitalized with COVID here in Michigan. Health experts are encouraging people to roll up their sleeves to prevent getting any 3 of the illnesses. The CDC says although we're in a much better place when it comes to COVID, the disease is ever changing.